Mamas, it's Dr. Vigo, physical therapist and founder of Painless Pregnancy, coming to you today with a quick discussion on what does diastasis look like on me. So this is a very popular condition that occurs in the abdomen after pregnancy. Now, during pregnancy, it can be considered normal. It can happen up to 60 or 70% of pregnant women in their third trimester. But diastasis becomes concerning or something worth looking at if after 2 months of being postpartum, your abdominal wall doesn't look quite right. So what does that mean? What that looks like can be slightly different per mom, okay? So we're gonna just go through a few pictures so you can be confident that this is or is not what you're dealing with. So one way the diastasis can show is as a dome. Okay, so this means when you put a load or a weight on your abdomen, it appears like a dome shape, like a triangle, like a hill, something like that, okay? And now you can see this in standing, but it should be notable. Say if you're laying on your back and you lift your head, or you lift your legs, like someone's gonna put a pillow under your knees while you're laying down, and then you look and your tummy becomes triangular, okay? So these are some pictures here where you see her tummy is here and then there's a big bump, okay? Same here, you can really see that. It comes up like a peak, okay? That's a big diastasis. All of that bump in the middle is happening between the linea alba sheath. It should be this short, tight piece of tissue that's no bigger than the width of your knuckle, but instead it's about 4 or 5 fingers width. Now here's a really narrow one. You see, we could probably fit about 2 fingers between, but that tissue is not behaving properly. So this is a picture of a diastasis, even though it's not very wide. Okay, the other way it can present is like a bulge. So the other pictures were more linear, like the whole length of the abdomen was up. This is where one section of the tummy looks like a puffer fish. Okay, you go to lift your head or pick up your legs, or maybe you cough or laugh, and your tummy pushes out like a puffer fish. That's another way your diastasis can present. And then the other look of a tummy that has diastasis is a sinking in or an invagination of the abdominal wall. So when you pick up your head, maybe nothing's coming up, but you notice it going down or sinking in. And that's here, you can't really see it too well, but the tissues don't hold the tension. They're not staying tight between the 2 six-pack muscles. Instead, there's like a softness to it, or like a lack of integrity. And this here, you can see it also where there's like a shadow where that tissue sinks down towards her spine instead of staying flat. Okay, so those are 3 ways that your tummy can look during a, as you are experiencing a diastasis, okay? And then this, it's another really pretty picture, but this can be a way that you look in standing, okay? So no pressure is going on here, but just visually you can see that her abdomen is not creating the same amount of tension around the whole area, okay? And here too, you see the stretch marks only in a specific area. That means her tissues were not stretching equally during her pregnancy, right? She was getting a lot more tension on those front tissues. So this is something that we treat commonly and we get phenomenal results, okay? The other thing I want to emphasize is if you're looking at these slides and you're thinking, that's not really me, like maybe I don't have diastasis, you're looking this condition up for a reason, okay? You have concerns about your abdominal wall. Maybe you've been trying to exercise and you're not seeing the results you want. We can help you whether you have a true separation, a true diastasis, or if you have a malfunctioning or less than maximum functioning abdomen. So if your stomach muscles aren't working great, whether they're separated or not, this is something we can help you with, okay? And I want to empower you before we're done with today's talk that it's okay to get help and be concerned about looking pregnant when you're not pregnant. It's okay that you want to go to Target and not have anyone ask you when you are due. I know we think maybe it's we're being conceited or we're too concerned about our looks, but truly, if you're working hard on an exercise or diet plan and you do in fact look pregnant, you should get help for that. That is a reasonable concern, okay? So don't brush it off. Don't think, oh, it's not important to anyone but me. If it's important to you, if you're researching diastasis, it's important. So let's get it taken care of. And let's talk about what's going on with your body and how we can help you today. Okay? The phone number you can call is 954-507-2010. And we can also be reached at painless-pregnancy.com. Thanks for watching, and we look forward to connecting soon.